the outcome of the block, and the examples are discography, facet, nerve block, SI joint block, and sometimes these blocks are diagnostic with therapeutic also. Whenever I give the first block, I always tell the patient, maybe you can require the second, because this is a diagnostic block. So they can know, they can come for the second injection or the permanent, like the radio frequency listening or the neurolytic block. So these, or sometimes even they don't come because they get good relief after the one injection. So it's both way they work, either diagnostic or the therapeutic both. So that pain treatment is start from the non-pharmacological region, like the physiotherapy or rest or just strapping the fractures and all, with the non-opioids, weak opioids, strong opioids, and then we have surgery. But what in between? So in between is the intervention pain management, where we can avoid some type of the surgery, like in the discogenic pain we can avoid the many disc surgery, only the simple disc prolapse we can treat with the intervention pain management. Sometimes many disease surgery can be avoided if we have the intervention pain management in our treatment are maintaining. So what is the intervention pain management? It is something people used to call me injection doctor, or sometimes doctor kya injection denge. Sometimes patients come and tell me, doctor has told me ki you are going to give me injection. So please write me the injection, I will go and take from the system. So this is actually misinterpreted by the injections. It is a blocks, it is I have to tell this is the procedures, but people usually, it's a common term is the injection. So intervention pain management techniques are the minimum invasive procedure, including percutaneous precision needle placement of drugs in targeted areas, or ablation of targeted nerves, and some surgical techniques. The target means ablation means radio frequency ablation or neurolytic ablation, or sometimes surgical ablation even. And the advanced techniques like the laser or endoscopic discectomy, intrathecal infusion pump, like the advanced pain management, spinal cord stimulation. For the diagnosis, as I said, diagnostic blocks has very important role, or management of chronic, persistent and intractable pain. So the target is the targeted delivery of the drug, aim of correct the pathology, sometimes as the local steroid work as anti-inflammatory, or sometimes, as I said, we give the stimulator which work on the gate therapy. So this way we usually sometimes correct the pathology, or we block the nerve signal current. This is a very common question I always across from the doctors, from the physicians, from the patients, how much time it will stay. People think I am giving something which is has the with the time. Actually, it's not time or something, because we give the blocks, diagnostic block or first blocks with the local anesthetic and with the some steroid. So local anesthetic has the action of only 3-4 hours. So patient should have the pain later on. Or the steroid, what the steroid actually nobody knows. It's still unknown how the steroid work. It is only the possibility that interruption of the nociceptive input or reflex mechanism of afferent limb or self-sustaining activity of the neuronal pool, and all these are blocked, and the steroid act like this. So these blocks, there is no time duration. Some patients develop after 2-3 days, or some patient even they don't feel any pain after one block. How they work, still unknown, but duration you cannot define the duration. You always have to take, you can require the second or third injection. Duration very difficult, maybe the 1 month to 6 months to few years. So duration to explain is very difficult. But it's not, it is a very temporary, you don't go for it, what will happen, you need the second injection. And of course the blocks are very simple procedures. It doesn't have don't have the surgery, or you don't require many things to do, or patient doesn't have to take rest. So nothing is harm. Even the people used to take insulin every day or 3 times a day. These are also injection. So to manage a diabetes, patient can take injection for 3 times in a day. So why not blocks for pain relief? Pain is very difficult to tolerate than having a diabetes. So patients, what type of patient you used to send, or you can send to us, like trigeminal neuralgia? patient is having, this patient 76 years old patient having the trigeminal neuralgia, not treated with any type of the medicine, lots of medicine, lots of Tegretol, gabapentin, pregabalin, sleeping all the time, still having the pain. What is the solution? Then you can perform always a block like the gasoline ganglion block. Very simple to do. We usually all the blocks done in the OT with the CM guidance. CM is very important. And if we do the radio frequency, it is very safe, because in radio frequency we always test with the stimulation. We only test the trigeminal ganglion. You can easily test it with the sensory and motor. With the sensory stimulation, we can know how effective it will be, and we are just stimulating the gasoline ganglion, so we can go, and it is very precise. Patient can go home after 2 hours and he gets more than 90% relief and long duration. Like these are the patient like cancer raised or the CRPS after injury or the phantom pain and all this pain, you can treat as the stellate ganglion block. Even you can give the continuous block in acute phase. It also helps. You can put a cannula and the catheter and with the pump, or you can do the radio frequency. Radio frequency if you do, it is a long duration, maybe 3-4 years patient, and CRPS, then meanwhile they cure, so they don't have the pain, and cancer 3-4 years is a good time to give a pain relief. The other patients usually abdominal, the other facial blocks which we do, the sphenopalatine block for the migraine patients, or maybe the maxillary mandibular block, glossopharyngeal block we have done here, the glossopharyngeal hypoglossal block, because the oral cancers are very common here. I find many patients of the oral cancer. So we do this type of the blocks. We can do neurolytic block with the alcohol, which can have the long duration. The facial in face we do always head and neck. We do many blocks. After that, you can go for the even the intercostal blocks for the intercostal neuralgia, or sometimes it is a costochondritis, or sometimes it is a CA breast or CA lung, and all this. Here you can perform the very simple. This intercostal block is very simply to do, very safe. You don't require many things, and you can do the neurolytic block with the alcohol. In abdominal pain, the most common like the CA gallbladder or the metastasis in the liver, even simple chronic pancreatitis. I have 3-4 children, 12 years to 14 years, who are suffering with the chronic pancreatitis, and these children, they used to take many sport wheel injections and duragesic patch, non-duragesic pad, usually absent on the examination. One boy I remember, which is this boy 14 and now he's 18 years old. He didn't even his exams. So when I have done twice the Syrian block. First I have done that, he has given 10, and again he developed the pain after 2 years. Again I have done the Syrian block. Now he is fine. He is now going to college. So here we can help, because otherwise they usually have the frequent admission with the injections, protein, duragesic, fentanyl drips, and all these things, and their studies is interrupted. So celiac block again very easy, and we have done many celiac block here. Back pain, as I said, most common, but most of the back pain you can manage with the intervention pain management. The 50% of the